Thank you so much, Vanessa. Hopefully everyone can hear me okay. So my name is Alexandra. I'm located in Edmonton and we are on Treaty 6 territory. And I'm here today to speak about a paper that I wrote in conjunction with a number of co-authors, including Kathleen Leslie of Athabasca University, Arthur Sweatman of McMaster University, and Ivy Lynn Bergeau of University of Ottawa, together with research assistants Geetanjali Sharma, Sarah Lazen, and Gwyneth Feeney. And this paper is part of a larger project about the legal and regulatory levers for harmonized collection and data sharing. And so again, this presentation is really part of a larger project funded by the Canadian Institute for Health Research to co-develop a fit-for-purpose health workforce minimum data standard, or MDS, that supports planning and workforce decision-making. And so we try to draw upon existing minimum data standards, both internationally and in Canada, include evidence-informed data elements with collection and stewardship considerations, and the idea is to have an MDS that is applicable across jurisdictions, integrates partner feedback through practitioner-specific demonstration projects, and is open access, so without fees. And the reason we believe workforce planning is so important is because a well-performing health workforce is really the backbone of an effective health system, and decisions made with respect to our health workforce should be evidence-based. And unfortunately, Canada's health workforce data collection infrastructure and analytics really does lag behind comparable OECD countries. So Canada lacks a centralized and coordinated data analytics and strategic planning infrastructure, which has sort of led to inadequate health workforce and intelligence. And one of the challenges that Canada faces in relation to workforce planning is Canada's federated legal system, which, without getting too much into the weeds, delegates certain areas of authority to the province, certain areas of authority to the federal government, and in some cases designates areas of shared authority between both the provincial and federal government, as in the case of health. And so, for example, and we're going to discuss this a bit more in a minute, it's the provinces who are responsible for regulating health professionals, and each individual province has their own legislative scheme to regulate health professionals, which can lead to a fragmented and uncoordinated data collection standard between provinces with respect to how they collect data from their health professionals. And it's this sort of mischief that this project is looking to address. And today I'm going to present just a small part of the larger project as part of the legal analysis group. And the purpose of our paper was really to identify legal and regulatory mechanisms that enable the sharing and collection of a more standardized health workforce data for planning. And this paper, this is sort of a presentation based off a paper that's been accepted into the Healthcare Management Forum, and we anticipate that it will be published, I think, in May of 2026. In terms of methodology, what we did was we conducted a comparative environmental scan of the health frameworks that govern health workforce data collection and privacy across 6 provinces. So we've looked at British Columbia, Alberta, Saskatchewan, Ontario, Prince Edward Island, and Nova Scotia. And we took this sample to reflect a geographic and demographic and regulatory diversity sort of across Canada and try to capture variations in privacy and professional regulation regimes. We selected 6 provinces to keep the study feasible, but this a potential area of expansion, of course, is to include more provinces as part of an extension to this project. And if you sort of need to leave right away, this presentation in one slide is that we found that there are existing legal, equity-based, and technical enablers in provincial frameworks and within Canada. And what we'll do is we'll explore each of these enablers throughout the course of this presentation. And perhaps most importantly, we found that a viable implementation of a minimum data standard is possible using targeted amendments and will not, at least for the provinces analyzed, necessitate complete legislative overhaul. And these amendments can be guided drawing from models and best practices already in place in other provinces, which sort of alleviates the need to reinvent the wheel for independent development for provinces who potentially don't have these enablers in place already. And so there's no need to start from scratch. So with that, we'll start with enabler one, which is the presence of umbrella legislation to regulate health professionals within the province. And umbrella legislation offers a unified statutory model that governs multiple health professions under a single legislative framework. And this can be juxtaposed to having separate pieces of legislation governing each profession, where there's a single statute that governs one profession. The model umbrella legislation allows provinces to streamline regulation, promote consistency, and more easily adapt their legal frameworks where needed. So, for example, they can enact a single amendment to this piece of legislation that will be applied to all professions falling under the regulation of this single piece of legislation. So, in Alberta, for example, we have the Disclosure Information Regulation, which is promulgated under Alberta's Health Professions Act. Alberta's Health Professions Act regulates 29 professions, and data from our health professionals is collected pursuant to the regulation. And so, for example, if the minimum data standard was to be adopted in Alberta, a single amendment to the regulation would then apply to all 29 regulated professions. And so we have a summary table here. It's important to note that all of the 6 provinces we analyzed did have umbrella legislation. Nova Scotia has a bit of a combination. They do have umbrella legislation. They also have some profession-specific statutes. But I'll draw your attention here to actually Saskatchewan, because Saskatchewan at the beginning of our research did not have umbrella legislation. Instead, they had 21 individual acts regulating 28 healthcare professions that were governed by 26 regular bodies. And this year, Saskatchewan enacted the Regulated Health Professions Act. So that's in 2025. And the point of this act was to amalgamate the 21 individual acts. And when they did so, they sort of acknowledged that we are doing this to bring ourselves into alignment with what we consider to be best practices across Canada that are already in place across Canada. And this is a great example of provinces leveraging approaches in other provinces to sort of modernize their own legislative updates. Enabler 2 deals with the explicit contemplation of data use and disclosure in health regulatory frameworks. So in our case, 4 case study provinces, Ontario, British Columbia, Alberta, and Nova Scotia, specifically contemplate in their regulatory statutes that the use and disclosure of registrant data for workforce planning purposes. And some provinces mirror that language in their provincial privacy legislation, and we'll talk about that in a moment. But this is really important because one of the intricacies of Canada's privacy regime is is that there are both provincial and federal statutes. And when it sort of poses one of the most complex issues in the discussion of health workforce planning. So when provinces specifically provide for the collection, use, and disclosure of registrant data for the purposes of workforce planning, it helps to provide certainty in Canada's relatively complex privacy landscape. It helps to promote data sharing, at least provincially, between regulators and health ministries, and it lays the foundation for a pan-provincial data sharing and a national workforce analysis. So we think that the first step is data sharing and cooperation between regulators and health ministries, with the second step being cooperation between provinces. So that will facilitate cross-border data sharing, and we'll look at that a little bit more in Enabler 5. But here is a sort of a summary. So here, Ontario is a good one to note. The Ontario's established the health professions database. So all colleges, except for medicine, are required to collect 59 standard piece elements of demographic data and information, and including demographic information, geography, education, and employment. And that all goes into the professions database. Other provinces like Alberta, they have simply a provision in their provincial statute allowing for the minister to request data, specific data collected under the Act. Saskatchewan and PEI are the 2 provinces that do not explicitly contemplate the collection of registrant data for the purposes of workforce planning. Enabler 3 highlights sort of the legal requirement that all collection, use, and disclosure of registrant data has to comply with Canada's complex privacy regime. And this is an enabler with a caveat, because in Canada, privacy protections attach only to information about an identifiable individual, which means if data is sufficiently anonymized, and anonymization means that there's no serious possibility of re-identification, either on its own or in combination with other information, that particular group of data falls outside of the scope of Canada's privacy laws. And at first blush, it might seem like a very streamlined solution, but it's sort of far from a panacea given the complexities of Canada's privacy regime and the need for high quality planning data. The other problem is that anonymization here is a bit of a sliding scale. So technology changes have meant that what is required to anonymize data might render the data increasingly generic. And what happens when data is too generic is that it might be diminished in its utility for analysis. And so it's sort of it's an enabler with a caveat in the sense that anonymized data might not actually, depending on the degree of anonymization and the degree of how generic it is, might not serve the purpose that we need it to serve for workforce planning. Some provinces have a potential solution. So Alberta is a good example here, where Alberta's provincial privacy legislation offers a potential solution because it says the provincial privacy legislation specifically specifies that the collection, use, and disclosure of personal information without consent is authorized under a legislative instrument, removing the need for anonymization. So the other instrument would be Alberta's umbrella legislation, under which the data is collected. So this provision works in tandem with Alberta's Health Professions Act, which we sort of talked about in Enabler 2, and to help ensure that the data that is actually gleaned and used for analysis is not too generic to be useful. Our fourth enabler has to do with, it sort of underscores the link between anti-discrimination mandates and the inclusive collection of health workforce data. So there is an increasing demand upon regulators to demonstrate fairness, inclusion, and transparency in how they register and oversee health professionals. And that begs the question about how do we get access to this data? And British Columbia has taken a leading role here. It's enacted the Anti-Racism Act of 2022 and then subsequently an Anti-Racism Act of 2024. And these laws allow for the voluntary collection of personal information for identifying and eliminating systemic racism, with data sharing being permitted and contemplated in the Act between public bodies and Indigenous governing entities. And the collected data is meant to directly support BC's anti-racism action plan. Ontario also has similarly mandates an ongoing anti-racism strategy, and they have several colleges are now collecting demographic data like race and gender in an effort to better understand inequities in registration and practice. So this has historically in Ontario, the Office of the Fairness Commissioner played a key role in linking these data initiatives to evidence-informed action. But we see that these sorts of legislation, these pieces of legislation, can be used as a model for collecting this information in other provinces. So here, British Columbia and Ontario are the leading examples. Nova Scotia actually does have an anti-racism legislation as well, but Alberta, Saskatchewan, and PEI do not currently have pieces of legislation that would allow for the collection of race-based data. And finally, enabler 5. So this is a focus here is on the technical and infrastructure backbone needed to support an integrated health workforce system or data system. And the great thing about this enabler is that all case study provinces actually do operate secure data centers with linkages across the federated system facilitated by the Health Data Research Network in Canada. And so we believe that data centers could play a crucial role in curating health professional databases, which are accessible to researchers and other analysts, and that they would satisfy the requirement that this data be collected, stored, and used in accordance with Canada's privacy laws, because the analysis would be conducted, or the data would be accessed, and the analysis conducted in a secure environment that ensures privacy protection. At present, these centers do not currently house much health workforce data. But we hope that In future, these environments could help in standardizing metadata, promoting interoperability, and facilitating data sharing agreements across sectors, ministries, and regulatory bodies. It also might encourage implementing minimum data standards for cross-profession and jurisdictional analysis if all that information could be housed and accessed in a single location. Um, at present, Canada has made some progress towards national databases of of healthcare professionals. So the National Registry of Physicians and Nurses Canada, but these are focused on the mobility of practitioners and sharing of disciplinary and registration data between regulators. But you can imagine that these bodies or initiatives could be expanded to support greater health workforce planning, particularly if that information was made available to be included in greater workforce analysis with data from other professions. So in summary, we found that there is key legal and institutional facilitators that already exist across several provinces in Canada, including umbrella legislation, explicit provisions that allow for the collection of registrant data for the purposes of workforce planning. That private universal privacy compliance is theoretically possible if sufficient anonymization um, is done to the data, or alternatively, if there are privacy statutes that contemplate the use of and permit the use of registrant data for the workforce planning. That anti-discrimination standards not only are important, but already exist. So models for anti-discrimination data collection already exist, particularly in British Columbia, and could be potentially replicated in other provinces. And we believe from an infrastructure perspective that secure data centers are going to play a vital role potentially in rolling out and implementing the minimum data standard of this larger project. And we really want to impart, I guess, in this presentation that while Canada's federated health practitioner regulatory landscape and legal landscape as a whole creates some challenges for data harmonization, it also offers numerous entry points for reform because key legal and institutional facilitators already exist across several provinces, and these existing facilitators can create a viable foundation for improved health workforce standardization and hopefully a better health system for everyone who lives in Canada. And we believe that implementing this system is possible, not with wide sweeping legislative amendments, in fact, without legislative overhaul, by using coordinated and targeted amendments, and that these amendments can be guided by using existing enablers that are already in place in other provinces, similar to Saskatchewan's move to adopt umbrella legislation in their province. And our hope is that once provincial and territorial alignment is in place, that's the first step. The second step would be a pan-Canadian coordination of this data, and so that the data and the evidence-based data analysis essentially wouldn't be limited to provinces, but available for Canadians as a whole. So yeah, thank you very much for coming and listening to our project. Oh,
Thanks, Alexandra. That was a wonderful, wonderful presentation. Lots of terrific research in those slides. So I'm going to open it up for some Q&A. We've got lots of time for discussion. This is a really important topic, and we've got lots of folks joining us this afternoon. So I'm going to encourage you to please put your questions in the chat. I will keep my eyes on the chat. And I think I will exercise my prerogative as the moderator to ask the first question. And it's sort of a broad-based question, Alexandra, and it might tie into some of the research that you're doing in other parts of your doctoral studies. I'm wondering about the impact of AI in this space, and I'm sure that sort of there's lots of ways AI might have an impact in some of the enablers. I know one thing that sort of struck me was around some of the discussion that you were having with respect to, anonymization of data, concerns about that being too generic, and then how useful is it? Certainly, it strikes me that AI might make it much more easy for data to be identifiable. AI could likely recognize trends and patterns and all sorts of things in data that we might not, which would then in turn require us to make that data even sort of more generic and possibly create more of a challenge in this space. So I'm wondering if you could speak to that, and then just more broadly about how AI might have an impact in this space, both for the good and possibly for the bad.
Yeah, AI is a big factor, and you've hit the nail on the head with respect to anonymization. So AI has sort of the goalpost with anonymization has changed with AI because AI, the the crux of AI really is making links where we would not have seen them before. So increasingly tenuous links are being made with AI, and so the identifiability of an individual given data that was perhaps once considered anonymized, sufficiently anonymized, might no longer be sufficiently anonymized. And so it's one of the risks, for example, of having this data out not being accessed through unsecured channels. So the proliferation of AI, the rapid proliferation of AI in our world, in a way, has almost made Enabler 5 more important in terms of having secure data centers to access this AI. Because it's true that having too generic data will undermine the analysis portion, which would totally undermine the evidence-based, the rationale for collecting this data. And so it's going to make secure access even more important. On the flip side, the AI is very, very useful for doing things which people have done. There are now uh, laws that discourage it, but for example, like scraping data from databases for use in analysis. So AI can be used to do that and scrape data, but there are some legal barriers that are sort of emerging to that practice now. Like many things, with the law is such a big ship to turn around, and AI is outpacing the law in many, many ways. Yeah.
Super, thank you. So we have a question in the chat. Someone asking about the role that Bill C-72 would have on provincial and territorial legislative coordination. If you could speak to that, you might be able to see it in the chat there.
Sorry, I don't know if my internet broke out. Could you just repeat that again for me? Or maybe I'll open the chat.
Yeah. So the question is about what role on enabling provincial and territorial legislative coordination.
To be honest, I don't know. I wouldn't speculate on that yet. It's a good question, but I wouldn't speculate. I don't know. Yeah.
Yeah, no trouble at all. So again, just encouraging folks to please, if you do have questions, please include them in the chat. So your summary slide had, and that was really nicely illustrated the various enablers. And of course, you've highlighted some of the challenges here on the conclusion slide. I'm wondering if you can tell us, we don't need a wholesale legislative overhaul. What's sort of the low hanging fruit? What could be done sort of, quite easily and efficiently in this space?
Yeah. I think harmonizing health workforce legislation, at least provincially, using an umbrella legislation is quite low-hanging fruit. There's ample examples of how to do that. Then second to that is sort of refining it, because not all umbrella legislation is the same. And so if your umbrella legislation doesn't, for example, specifically contemplate collection of this data for the purposes of health workforce. So we know Saskatchewan, they have brand new umbrella legislation, but it does not contemplate it. That would be the second like element, in my view, is the low-hanging fruit. Most the secure data centers already exist, so that's more about making use of infrastructure that, at least in the case study provinces, are already there. And then a more perhaps difficult, not difficult, but a step beyond in difficulty would be to have your provincial privacy legislation mirror your health workforce regulation by contemplating use of or disclosure of data without consent, provided that it's enabled by another piece of legislation, which would work in tandem with their health regulation. So that's a little bit I think more advanced, if you will, but I think the lowest hanging fruit is simply to harmonize health workforce regulation in the province.
Super, super. Thank you. I'm just looking in the chat. Are there any questions? There we go. We've got someone asking about your whether or not the work is going to be published. I think you mentioned a little bit some about publication, so perhaps you could reiterate that. And then a second question about examples of the data centers. If you could speak in more detail about those data centers.
Yeah, so the work will be published. It's been accepted for publication in the Health Management Forum, um, which is a publication that will be out in May of 2026. So that will be coming out. I don't know if we might, I'm not sure if we share papers. Ivy could speak to this more. If we share, if it was like more immediate need, would we share the publication in advance? And I don't know if we would do that, but maybe Ivy could speak to that. And then with respect to the fifth enabler, sorry, they just wanted to know
So
more about.
just wondering about examples of those data centers.
So they actually have physical centers or data centers, and they have them in BC, Alberta, and Ontario, and they house which houses secure information. And then you get access through ethics approval, essentially, to do certain studies with the data, and then you're subject to all these rules. So these data centers, these secure data centers, actually already exist in every province, and you can use them to analyze sensitive data. And the need for anonymization is much less because the data is being analyzed in a very secure facility. The data is being housed and kept secure within the facility. And so we believe that we can sort of leverage this infrastructure to house more data. So not changing the infrastructure, just changing the type of data that's housed there. And our job, in a way, is to collect this data and so that it is usable.
Okay, super. Um, Another question in the chat, wondering if there's been any interest or response from the government, from any of the government stakeholders.
I think so. Um, this paper has yet to be published, but I think in the larger project, I think the answer is yes. But in terms of stakeholders, lots of interest too from regulatory stakeholders. So, uh, but the degree of interest, I think Ivy can speak to from the federal government. I don't know that answer, but yeah, I think there is there's interest, and also I think and some of this presentation was designed to assuage some of the fears that come from some of the undertaking, and particularly in the privacy context, that this is not sort of a long shot or an insurmountable goal, that it is very possible with existing legal levers.
Yeah. Yeah. So Ivy just posting that Data New Brunswick is the only provincial data center that presently holds health workforce data. And she's got a link to an article if anyone's interested in reading a bit more about that. It's available in the chat. So maybe I'll do a last call for questions in the chat. This has been a really interesting presentation and some great questions. And I think if I don't see any other questions, I think we'll thank you very much, Alexandra, for joining us this afternoon and for your presentation. It was a really excellent discussion. Thank you.
Thank you very much for having me.
Thanks, everyone.